Hi guys, Johnny Wilson here and Paulina, and we are looking at the Taylor tilt test, and we're looking at the calcaneofibular ligament in particular. So it's called the calcaneofibular ligament because it goes from the calcaneus to the fibula, and it keeps these two guys together. So it kind of goes backwards, as you can see. So it gets stretched. It gets very tight when the foot is on dorsiflexion. So it goes that way. If you've had a lateral ankle sprain and it's quite a severe sprain and you've done your anterior drawer test and that's got an increased anterior drawer, then you might suspect that there may also be a calcaneofibular ligament tear. So the theory goes is that if you fixate above there's many ways to do this. This is the way we do it. So I fixate above the malleolus. So you've got your lateral malleolus and your medial malleolus. Fixate here. Bring your palm and catch the heel. So the patient's foot now rests on the anterior aspect of your forearm. And what you do is you bring the foot into dorsiflexion or into neutral. Okay. So she's slightly in plantar flexion, slightly in equinus. I want her to get into that position. I haven't got three hands, so what I can do is just grab the calcaneus, because that's the bone I want to manipulate. And I want to take the calcaneus away from the fibula. And I'll do that by going into inversion of the subtalar joint. Subtalar joint is the talus and the calcaneus. So resting the patient's foot on my forearm, bring her into neutral, and then I'm going to adduct or invert the calcaneus away from the fibula. Now, if the patient reports pain or if there's increased laxity in comparison to the other one, so it adducts or it inverts a little bit more, then you would be suspicious of a calcaneofibular ligament. So again, if you've had a positive ATFL, so you really have to have a positive anterior drawer test first. Very unusual for the calcaneofibular ligament to be injured in isolation. So usually when this ligament is injured, this one is injured first. And if the CFL is injured, the calcaneofibular ligament is injured, it's a sign of the severity of the injury. So it's a more severe injury. And you're probably looking at a grade 2 to grade 3 unstable ankle. So mechanically unstable, meaning that the talus moves quite a lot more, moves forward and rotates within the mortise here more than it would do, because these two ligaments, they provide restraint against plantar flexion and rotation, inversion, eversion, as well as we talked about, inversion and eversion there. So that's the Taylor tilt test for the CFL. Again, you have to have torn your ATFL for this really to have gone in practice and in theory. So hope you enjoyed the test, guys.